I just thought we would start by going over some of his tests that have been completed, and I'm sure you know some of the results, but I'd like to go over them with you. First of all, his severity score, which is also called his Haller index, which is derived from the imaging study of his chest that we did, shows his deformity to be 4.96, which is moderately severe. Anything over 5 is 5 to 5.5 is severe. So it's just a little bit under what we would call a severe deformity, but clearly exceeds the standard of care for a NUS procedure. So in terms of the imaging study, it's clear that, he meets the standard of care. He has an extremely interesting deformity in that it is very, very, very focal and deep. So often in patients, if you can just sit forward, Jimmy, often in patients, the area of depression will be over a longer area of the chest wall, but with Jimmy, it's fairly focal and fairly deep. And his bar that he'll need is going to be a 14. So I'm going to take a 14 template. This becomes sort of like my pattern for bending the ultimate bar. This is the actual bar, okay? It's made of surgical steel. It is of the same thickness and width in every patient. It just comes in different lengths, okay?
I have a question about nickel allergies. Our oldest daughter has a nickel allergy, as is my sister. And your nurse Jackie mentioned perhaps getting him a true test. Because there's nickel in stainless steel, correct?
That's correct.
Okay.
But does he wear jewelry or have a watch or a belt buckle or anything to suggest that he has a nickel allergy? Does he have any?
He used to wear a Nixon watch, big watch.
And did that bother you?
Not at all.
Okay. Well, we can surely, if it would give you comfort, we can surely do it. It's not a big deal to test him.
So then the other option would be titanium?
Right.
And that's a little bit more labor intensive and...
Yeah, it's a bigger deal. A titanium bar requires the company to bend it according to dimensions that we give them. It can't be done by me, and the titanium is so hard that it has to be bent by machinery at the manufacturer. So titanium bars are used exclusively for patients who have nickel allergies. But we surely can do that. I'll just tell Jackie to go ahead and do the true test. It's pretty simple to do. Great. Perfect. Okay. I'll see you in May.
Okay.
We'll take good care of him. He's going to do great. Okay?
Thank you very much.
See you, Jimmy. Any other questions?
No.
Okay. Take care. Thanks for coming.
Jet free, kid.